I believe free market principles should be applied to our healthcare system, and we're seeing the damaging effects when you have essentially a government takeover of our healthcare system. We've seen the rising costs, the rising premiums. I was talking to a woman in Danville a couple weeks ago, and she and her husband both work. She carries the insurance for her family, 6 children, and she told me that she just got notified that her premiums are going to go up by $600 a month. $7,200 a year in new premiums for her health insurance and higher premiums. And I said, how are you going to accommodate that? And she just has no idea right now, and they're trying to figure it out. But I hear time and time again as I travel the Commonwealth about the skyrocketing premiums as a result of too much government intrusion in the healthcare marketplace. We also know that people are losing the insurance we like and the doctors we trust as a result of this government intrusion. And we know, according to the Congressional Budget Office, that there will be 2.5 million fewer workers in our economy over the next decade because of the disincentives to work built into Obamacare. And that's why I believe we need to replace this government intrusion and all of this taxation, mandates, and regulation. By the way, speak one more regulation, you know, a lot of hourly wage workers are seeing their hours reduced to 28 hours a week as employers try to avoid the 30-hour-a-week full-time employee regulation. Small businesses capping themselves at 48 employees so they don't lose their small business exemptions. Those are the perverse effects of too much government intervention in our healthcare sector. I believe that market-oriented reforms that would, for example, remove barriers to competition, as we see in the healthcare marketplace when it comes to insurers being able to compete across state lines. We don't have that barrier in the auto insurance market or the life insurance market. It shouldn't be there in the health insurance market. Now, I think there are, steps you would have to take to ensure that if a Virginia company is competing in Tennessee or a Tennessee company is competing in Virginia, the Tennessee company would have to play by Virginia's rules, but they should be able to compete across state lines, and that would put downward price pressure on the cost of health insurance premiums, and would be good for the consumer. The employer-based tax incentive is antiquated in today's economy. It's rooted in wage and price controls from World War II, but people change jobs 6, 7, 8 times in the course of a career today. I believe the employee should have the same benefit or the option for the same benefit as the employer is provided in terms of the tax incentive. I wouldn't eliminate the employer tax incentive, just equalize it, the treatment for the employees. And that way, by the way, if the employee had the benefit of the tax incentive and purchased the insurance and changed jobs, would not be at risk of losing insurance for a pre-existing condition. I think that we need more medical savings accounts that have been gutted by this administration, and that puts the consumer in closer contact with the price of the good, which we don't have in the healthcare market like we have in other markets in this country. And I would also support very strongly to have some limits placed on medical liability awards. People need to have and must have recourse in our judicial system in the event of medical error, hospital or doctor. We can have that without having exorbitant rewards that end up driving up premiums for those who are insured and causing doctors and hospitals to engage in practices of defensive medicine, ordering 3 or 4 tests that aren't really necessary but to inoculate against the potential for a lawsuit. I think reforms like that would make healthcare more affordable, more accessible, more portable, prices more transparent, and would not cause us to lose the insurance and the doctor we trust, and would not have the negative impact in the job market. What we've seen right now is that when this bill was passed, the Affordable Care Act, it was justified by saying there are 47 million uninsured in this country. We now know when it's fully implemented, there will be 30 million uninsured still. We have upended an entire marketplace to expand coverage to 17 million Americans. And created tumult and confusion and chaos and higher prices and lost plans and lower wages for the 255 million people who had insurance before that bill was passed and were comfortable with it. And so we need to revisit this, and we need to start fresh and start anew with market-based reforms.